Hello, and welcome to today's webinar, Continuing Citizen Service Delivery and How You Can Adapt and Expand Service at a Time of Crisis. My name is Haley Malone, and I am your host and moderator for today's content. But before we begin, I just want to mention a few housekeeping items. First, today our webinar is scheduled for 1 hour. The audio will stream through your computer speakers. If you have any questions during the presentation, please submit them through the Q&A button located at the bottom of your screen. We will answer all of the questions at the end of the session, but if we don't get to your question, we will reach out to you via email. And finally, this session will be recorded and available for replay on demand. I'm pleased to introduce our speakers for today. First, we have David Moody, who is the Vice President and General Manager for Verint's Engagement Management Professional Solution. And we also have with us Iain Daws, who's the Director of Marketing, specializing in the public sector. Thank you again, everyone, for joining, and let's go ahead and get started. So over to you, Iain.
Thank you, Haley. Thank you, and welcome, everybody. These are indeed unprecedented times. Government at all levels and voluntary and non-profit organisations are bearing the brunt of providing essential public services of all types, and they're trying to reconcile the tension between keeping employees and their families safe, and maintaining and continuing to deliver essential services, and absorb the additional work and deliver the additional services that have been demanded by the pandemic, by the crisis that's surrounding it. The picture, we don't need to tell you, is changing from hour to hour, and that adds further uncertainty and stress to everything that we're all trying to deal with. So we hope that during the course of the next hour, we can provide you with some food for thought and maybe even some reassurance that it is possible to support many of these additional measures with technology and tools that you already have at your disposal, quite possibly, or which can be provided to you quickly and reliably. Of course, you're already in the thick of it, as are all us. And normally we finish these events by thanking you for your time and your attention, but on this occasion we'd like to start by thanking you for all your efforts and dedication to keeping us all safe. The lengths that public servants are going to around the world to safeguard the vulnerable, support those in need, and keep essential services running are truly extraordinary and deeply appreciated by us all here at Verint. So, as I said, we would like to say thank you to you. So, let's start by considering some of the challenges that we've been hearing are being faced by public sector organisations from a number of different perspectives. And first of all, we're concerned about vulnerable citizens, the old, the sick, the housebound, those who've been advised to isolate themselves even if they don't actually have the virus. But we shouldn't forget that there are also many people out there who are willing and able to help those vulnerable citizens, and harnessing that resource quickly and effectively will help us to increase the contribution that's being made to fight against this terrible disease. And for the organisations that are tasked with safeguarding those vulnerable citizens, as well as looking after the welfare of the rest of the population, there are a far greater number and variety of concerns, and these range from ensuring that your staff can continue to deliver those essential services even if they are working from home, through organising the delivery of new and amended services demanded by the crisis in a controlled and manageable way, all the way through to marshalling the additional resources that you need to do all of this. So what we're really talking about is being adaptable. I guess we're all having to be adaptable, irrespective of our role in life. Everything's changed. But our focus today is on providing you with some insights and inspiration and ideas that will help you to manage these challenges as much as possible with the tools that you already have at your disposal, which is just what my local supermarket, which is what you're looking at here, did in order to create a queuing system to support a one out, one in policy for the shoppers who are allowed to go into the supermarket. And here what they've done is they've used warehouse cages, which just happen to be about 2 meters tall, and they've laid them on their side at 2 meter intervals and then marked out a queue snake through a part of the car park. So adaptability is going to be key to managing the challenges that we face, and what we'd like to do is help you to tap into that. So let's look at it, first of all, from the point of view of vulnerable citizens. Those considered vulnerable, most at risk from the virus, for them these are worrying times. They may have been told to stay at home and keep themselves isolated, but that's not always to achieve or easy to achieve. How do they get food and medicine? There may be help available, but how do they find out about it, and where do they ask for it, and how will it be delivered to them? David's been working with and talking to people who are dealing with this very problem, so I'm going to let David tell us a bit more about what we're seeing out there. David.
Thanks, Iain. So, so we're seeing government organizations across the world prioritizing services for those who are at very high risk of severe illness from coronavirus because of an underlying health condition. That's where the priority seems to be across the board from a government perspective, and that includes children as well as the elderly. These people could be living at home, but they could also be living in long-term care facilities. They could be your mother, your father, husband, wife, whatever. They could be. We're all connected to people like this. The government agencies responsible for providing services to such vulnerable people vary from country to country. So, for example, in the UK, it would be English county or unitary local authorities in England, and in Scotland, it's every local authority, because they're called unitary councils, but they're self-contained. In the US, it's typically the county government. It's not local. It's not cities. It's the county level. So it does vary. But what's consistent is this concern and responsibility to help. So if we take the UK as an example, vulnerable people who are at a very high risk of severe illness have been identified, and I'll explain that in a moment, but they've been advised to minimize all interaction with others for at least 12 weeks. So many countries, as we all know, and in fact in the States it varies from state to state within the United States of America, but some states, for example New York, everyone's self-isolating, have to stay at home and only go out for essential reasons. But for these vulnerable people in the UK, they call them shielded patients. They've been told to minimize all interaction for effectively 3 months at least. So what do we do? How do those people get food? How do they get medicine and so on? So government organizations, government essentially is accountable to make sure their needs are being met. Now we can proudly say that Verint technology is supporting these new use cases or situations that are unprecedented. Whether it be helping with the delivery of or coordinating the delivery of food parcels, identifying people with needs and so on. So, for example, Verint technology is being used today in the UK to ensure that all shielded patients get contacted and their needs recorded. let me explain that for a second. So in the UK, the National Health Service has provided a list of people in each local authority area that are classified as at risk from a very high risk of severe illness. And that list is provided to each local authority. We know that a number of our customers are using our technology to contact everyone on that list and record their needs. Of course, again, Iain has already mentioned this, not all people that are at a very high risk of severe illness are, there are more than just those people that are vulnerable, okay? So not all vulnerable people have a underlying health condition. It could be some other reason. So they need to be contacted as well. So again, our Verint technology is being used. We know this because we're supporting some of our customers to do this. It's been used to allow vulnerable people or their families to register themselves as being vulnerable and in need of support. In other words, we know that obviously the vulnerable people themselves may not have access to the internet. We know that, and of course our solution has to support the ability for their children, spouses, whatever, to be able to contact and register. So we have that, and we know our solution's been used to do that, which is great. We also hosted a webinar on Tuesday of this week, 2 days ago. So a lot's been going on this week, where we demonstrated that very solution and how Verint technology is enabling these very processes. So we will show you how to get access to that webinar before the end of this recording. So we will come back to it. So if you are interested in that, I'll make a few references to that. So we'll watch this space. Okay, so there are different types of vulnerable citizens do cover a number of different definitions. We've talked about those that are at high risk, but that's not all. You know, it does include children. It includes the homeless, and those that suffer from or develop mental health issues. You know, we know this is a priority for our customers, for our government organizations. You know, one government organization told us last week that their priority, and this is absolutely common, but this is word for word what they told us, is the safety of vulnerable children, getting homeless people into accommodation, and answering only emergency calls. So again, we see as a common theme the prioritization of service delivery with a focus on those that are in need, which is quite right and proper. I mentioned mental health issues. This could be for people who have mental health, pre-existing mental health issues, but it could also be the mental pressures that are developing as a result of the strain that we're all being put under because of COVID-19. You know, stress is no joke. And whilst we all try to keep focused and positive as professionals and do our job, it can and does get to us. We are human after all. So, you know, from me to you, make sure you're taking time to, you know, to manage the stress with your families, with your extracurricular activity. It's very easy just to sit at your desk all day and just work. And really, we all need to be looking after ourselves. So, yeah, so that's why, more generally, that's why organizations such as the Samaritans and the National Suicide Prevention Lifeline in the US are expecting a significant rise in the number of calls they take, unfortunately, as a direct result of the extended lockdown conditions that much of the population are enduring across the world. And also, unfortunately, we've seen this and heard this on the news, our local news, I'm sure, and national news across the world, child protection and domestic abuse services, unfortunately, also are likely to see similar increases. And, you know, we are working with an organization just like what I just talked about to help them deal with a situation and the increased calls they're getting. And we'll talk a bit more about that in a moment or two. So back to Iain.
Thank you, David. So for everybody who's saying that they need help, there will be other people who are saying, I want to help. So if you want to volunteer your services to help your community's response to the pandemic, you'll need to be able to find out how and where to offer them. And you'll have some kind of process you'll need to go through in order to register that and receive assignments. And specific programs may also need to be set up to address this. and you'll need to adequately promote those and resource it if you're going to get the most out of volunteers and community organisations and non-profits who operate in that arena. What are we seeing in this area, David?
Yeah, so again, for some of our customer or government organisations, this is something you've been doing before, but for others, it's a new thing, and it's going from not being an issue at all to a massive, challenge, but also an opportunity. So, I mentioned a moment ago that we were working with a non-profit organisation to provide emotional support to anyone in emotional distress. And like many similar organisations, they are experiencing increased call volumes from people who just need someone to talk to. This means they need to get more volunteers registered, vetted, and trained so they can start providing help and advice from their homes. Again, maybe proud's the wrong word, but Verint technology is being used here to automate the registration and vetting process, allowing this organization to scale their operation, get more volunteers in quickly and safely, but also to provide those volunteers with support through a community available only to them, a software, like a technological community that can provide them with much needed emotional and educational support to help them provide the best advice and guides to the people that they're talking to on the phone. Elsewhere, and this would be more obvious to everyone, government organisations are working with local volunteers, community groups, and others to augment essential services. But this all needs coordinating, as you mentioned earlier. So a critical element of this will be the measures put in place to encourage and allow citizens to volunteer their services. Promotion, recruitment, and the gathering of information about volunteers, their availability, the capabilities they have, their location, and so on, need to be frictionless, really easy to do, efficient and effective for this to work well. Once volunteers are registered, they may need to be vetted or subjected to some form of background check, and then made available to the pool of volunteers so they can be matched and assigned to help appropriate vulnerable people. In the UK, as mentioned here, the UK government launched an appeal for 250,000 volunteers to help deliver health and other support services, and they got 3 times that. It's fantastic, and a real sense of community and spirit, but of course these need to be processed and vetted as well and screened. Once again, we can proudly say that Verint technology has been used by government organisations to enable volunteer registration, vetting, and matching with people in need. Again, I mentioned earlier that the webinar we hosted on Tuesday, this also demonstrated, that included a number of different scenarios, more of a solution-focused webinar, but it showed a number of use cases which included the matching of volunteers to vulnerable needs. And again, we'll show you how to get access to that if you're interested before the end of this session. And of course, social networking apps that we all use are already being used to mobilize volunteers and are playing an incredibly important role themselves. However, we've heard, some of our customers, our government organizations that we work with have said the challenge with that, though, is understanding the extent to which they can rely on such volunteers who say they're going to do something, doing what they say they're going to do, and figuring out the holes or the gaps that government themselves need to plug. So that is another challenge for sure. Yeah.
Thank you, David. So let's move on to look at some of the key challenges that are being faced by the organisations that you work for. I said they're staying on top of a fast-moving situation, and boy, is it fast-moving. So being able to rapidly set up completely new services is going to be imperative. We don't have the luxury of time to fine-tune things, so taking an agile approach to doing this is going to be absolutely key. And in such a fast-moving situation, getting the latest and the best information to your staff and to the public about the pandemic itself, about regular and special services that you're providing, about the processes and protocols that are associated with those, is going to be key to maintaining public confidence in the measures that are being taken and making sure that those who need help can access it easily and quickly. Being able to do that, getting that information into people's hands in a smooth, easy, frictionless way is also going to help to take pressure off the pointy end, the frontline services, the people who are having to actually deal with the applications. And as will harnessing the many people who want to help, as we've just been talking about. You may also need at some point to play a part in helping to identify and track those who are suffering from the virus. And perhaps your area incorporates airports or ports or border crossings, and you're otherwise at the front line of making sure that we're not importing cases as well as dealing with the homegrown problem. And finally, your staff are going to need help, not just with the processes, but just coping with the situation. This is not normal. Your staff might be feeling, well, at best, discombobulated, struggling to keep up, maybe even fearful. Some of them will be juggling work with keeping their kids amused and safe and feeling disconnected from their normal work-related support network. So that's a pretty broad range of challenges, and I've kind of summarized them there for the organization to be facing up to. David, what are we seeing in this area?
Yeah, so keeping everyone up to date is something we see across government organizations across the world. So the media and social media, fake news aside, and there's a lot of that to do with COVID-19, but it's performing a critical role in communication. But in addition to that, citizens still turn to government for definitive answers. So it's no surprise the government organizations everywhere are being inundated with calls. Questions about COVID-19, like, can I go to the beach? Can I exercise outside? When will the lockdown be over? How do I know if I have it? How can I get help for my elderly patients, or parents, sorry, and so on. So many questions. And the answers to those questions, some of them change on a daily basis. So it's vital to ensure your staff and the public have the latest and most accurate information about the pandemic, regular and special services, processes, and protocols. Public services everywhere are struggling with this increased demand, and often from hour to hour, and the capacity of service centres is hampered by staff having to work remotely. They also have to juggle childcare and other domestic concerns like keeping their kids going through school lessons, and that's a nightmare, I'm sure. Well, it is a nightmare I'm experiencing myself, and familiarise themselves with the new processes and protocols. It's hard. Citizens too are finding it difficult to cope when access to service touchpoints is restricted. Many vulnerable people typically like to speak to someone face to face, and now can't do that. Many older and vulnerable citizens may not be digitally enabled and find it difficult to cope without their human contacts at your organization. Just on a personal note, not rehearsed, I'll give you one example of that. My mother-in-law is not very digitally enabled, but she recently, just through this last couple of weeks, has started to use WhatsApp. Other social networking applications are available. And she has started to use video. And the plan that she is on has run out very quickly, so I've had to up her plan. Previously, she had no interest in video, and now she sees that as a key way to keep in touch with people, and specifically her family and our family. So that's one thing that's very easy to fix, and if you haven't thought about that, do think about it. Even for people who were previously hostile to technology, they're now discovering this can be a really good way to keep in touch. So just one personal example. Thinking more back to government again, an example of where we've been helping, our technology has been helping is the CDC, the Centers for Disease Control and Prevention, a long-standing Verint customer. They have recently experienced a huge spike in website traffic, as you might imagine, and we've been helping them to leverage analytics to drive COVID-19 insights. These might include analyzing a proportion of visitors using a mobile versus device, a desktop device, thus guiding future prioritization of customer experience developments. Just one example. Also, many of our government customers use Verint's knowledge management technology. And of course, if it's not obvious, that allows those organizations to deflect calls to the web, as well as enabling their staff to answer questions that do come through over the phone more efficiently in the contact center. And crucially, these can be updated rapidly and made available immediately to both public and staff. And we're doing that today. I know that technology has been used over the years for localized incidents and emergencies, and I've got some, I'm not to digress now, but I know it's been used many, many times. These government organizations also have Verint's case management technology, which enables, again, enables citizens to transact online rather than having to speak to an agent. And when you've got like a massive increase in interactions, you need to be able to deflect as many calls as possible to the web, both for information and also to transact, otherwise you're just not be able to cope. So again, we're helping there, and it's helping, that tech capability is helping government organizations deal with the demand. Crucially, this also allows you to launch new or modify existing processes or apps quickly, both for citizens to use online and for employees to use working from home. So what I mean by that is, some of these processes are already in place. Some of them are brand new, and our customers are able to deploy new user technology to deliver these new, or support these new processes, or enable these new processes within days, hours even. Again, the webinar I mentioned that we did on Tuesday demonstrates a number of these apps that have been built on top of our case management, so configured on top of our case management technology. So if you're interested in any of this, then I strongly recommend you watch that recording. Finally, on this one, communities are, I mean communities as in a technology community, like forums. They're an established way of disseminating information. Information often goes viral, can often go viral and rapidly reach people through the sharing of links. This applies both to the public, but also to employees. And I mentioned how that example earlier is using internal communities to make sure staff that are dealing with difficult calls are getting the support that they need. And then helping staff cope. So we talked about this earlier. This is for everyone, not for us, for us as presenters, but also you as listeners and your colleagues as well. So as Ian said, this is not normal. Your staff may be confused and disorientated, struggling to keep up, maybe even fearful. Working from home, some people are used to it, I know, but many are not. Many people like myself like to get out and meet people. Meet some of the people. I see some familiar names on this webinar. Hi, Chris. So it's difficult for, well, I find it difficult not to be able to get out and meet people. So and you're juggling, we're all juggling work with keeping our families, our kids amused and safe and so on. And also, we're disconnected from normal work-related support networks. So that's difficult too. So again, having an internal community, a collaboration environment, or even just an instant messaging app can help us all stay feel connected to our normal work-based support network. So, I encourage you, and I encourage you to encourage your team members to use those tools to reach out to your colleagues. My WhatsApp has been pinging here on silent through this call for my colleagues. They're just doing exactly that. So that's important, and it's important we keep ourselves right, our mind right, and our bodies right too. So remember that informal, unstructured communications are as important as official channels. And again, getting back to some more serious things, so knowledge management can also be used to publish internal-only content, which can provide additional information and support on work-related concerns. And then another, just very briefly, we covered this on another webinar in this series, our workforce management solution. We had a full, at least one webinar on that. and that can be used. Obviously, that's used to schedule work or employees or staff in contact centres. Of course, a lot of our, all of our customers are now working from home, and I know that our Verint technology for workforce management is supporting that work from home, those schedules as well, which is fantastic. And then finally, for me, and then I'll hand back to Iain. And Iain touched on this as well, as the tracking and controlling of infections. So we've heard a little bit about this in the last couple of days, and I think there's going to be more focus on this on the next, coming weeks as we start to see light at the end of the tunnel. So, government has a duty to protect everyone, not just the vulnerable. And we are also working with a number of government organizations to record and track people with symptoms. One of those is a government organization in South America who wants to record all citizens, all people returning to their home through the port of entry, whether through, mainly through the airports in this case, specifically to record those with symptoms so they can follow up with them to ensure they're self-isolating where applicable, but also maybe not developing symptoms thereafter. As we know, not everyone will realize they've got the virus until immediately, because they'll maybe not displaying the symptoms. Another one, perhaps more controversially, that's being considered is an application that would be able to alert individuals if they have been recently in contact with someone who tested positive for the virus. Now, this sounds, when I first heard about this, it sounded very Big Brother to me. But the thinking is that this could limit lockdowns, which, if true, could allow this idea to become reality. So I think we need to watch this space on that one and see how that develops. Iain.
Thank you, David. So just pull some of those threads together, because we've talked about quite a lot of issues and different ways in which various public sector and non-profit organisations can and are responding to this pandemic. They're doing that by setting up and launching new and adapted services to help the vulnerable, to help them adjust to new working conditions, to keep the public informed, and to take pressure off frontline service staff. And the best of those are taking an agile approach to doing that. As I mentioned earlier, speed is of the essence. So looking for ways in which existing services and associated processes can be used as a template rather than designing something from scratch is an important way of getting ahead of the game. From experience, I would say if you're doing that, don't be afraid to fail. But if you do fail, fail forwards. Keep what works, but change what doesn't, and you'll very rapidly, very agilely get to where you need to be. We've talked about volunteers. They're going to be an essential part of beating this, and you may also need to harness the efforts of additional volunteers to deliver all manner of services and support. So thinking about how you're going to reach out to them, identify those who can help, but also what reasonable processing, as David talked about, background checks, for example, you'll have to subject each of them to before you can responsibly start assigning them to do work. Now, it's kind of stating the obvious to say that the support of communities will be critical to managing this crisis. And this will be critical to you getting out the essential information and messages, and critical to many of your most vulnerable citizens coming through safely. So helping and encouraging them to connect with the people around them, their local community, can help to increase awareness and also to get those services delivered. And in that regard, as we've touched on, the use of some kind of online community or forum or social network is a useful way for citizens not just to find information, but to help one another and to offer their services and look out for those in need. It's also a community-focused place where they can discuss issues openly, and that acts as a safety valve. And don't forget that some kind of internal community is going to be important to your staff, particularly those who are used to being based in an office or at least working directly with people on a daily basis. Those water fountain conversations are important. Sometimes they're to do with work, sometimes they're to do with what you had for dinner last night, but they help to break up the day. They help to make people feel part of something. And for your staff, they're going to be feeling under additional pressure. They're working at home and work is going through the roof at the same time. So something that helps them feel connected is going to be very important. And as we've mentioned, we can help with advice about setting up such facilities and with the software to do it if you need it. And finally, making sure that all of that latest information and advice is regularly posted to your portal, ensuring that it's as prominent as it can and needs to be, is going to be very, very important. And if you've got a knowledge management tool, perhaps that feeds your contact center staff as well as your online frequently asked questions, then great, because both your staff and the public will receive those updates simultaneously. And that's important because I think at times like this, conflicting advice is the bane of your life. So aim for one version of the truth. So that concludes the formal part of our presentation. I know that David wanted to tell you a bit more about the webinar that we ran earlier on in the week. So let me just hand back to David to describe what that was all about.
Yeah, so I've talked about it a couple of times, or 2 or 3 times during the webinar. So yeah, so it's more of a solution-focused webinar, but it will actually show you how the Verint technology can help you manage your vulnerable shielded citizens, manage volunteers, match volunteers to vulnerable citizens, report on progress and escalate where necessary. The solution is cloud-based. It's available immediately if it's something that can help address some of your use cases or scenarios. It is something you can stand up in a number of days, actually, a matter of days. And the webinar recording is available. I think it's from the resources link on through the platform that we're using, and you can access it directly. Alternatively, I'll be posting it. I haven't done it yet, but I'll be posting it to my LinkedIn profile, and you can get to it from there as well.
Thank you, David. So now's an opportunity for you to ask any questions that you've got. Hayley, you're going to keep an eye on the Q&A for us. So what do we have?
Yes, so thank you, David and Ian. And at this time, we're going to transition into the Q&A portion. We do have a few questions, but just as a reminder, if you do have a question or a comment, you can submit them through the Q&A button, which is on your console. So the first question we have for either you, David, or Ian, can you give a specific example or use case of a nonprofit organization benefiting from some of the solutions you've talked about?
Yeah, so I don't want to be specific because we need to get specific permission before we can name specific organizations. But yes, I mentioned one earlier that we are supporting in a part of the world, not in the UK. I'll say that, and it's one that provides that sort of emotional support on over the phone, what we're doing there is helping them get more volunteers vetted more quickly and trained, and then providing support through an internal community that only volunteers have access to, that kind of emotional support for them, so they can provide better support to the people that they're taking calls on behalf of. And from a technology perspective, it's case management, it's portal, it's workforce management, and it's community.
Great, thank you. You talked a lot about using these solutions for vulnerable citizens. but is there an easy transition from, staff or implementation from staff to actually the vulnerable citizen accessing the tool? And how fast can these solutions be implemented?
Would you mind repeating that so I can just get the beginning of that question because I missed it?
Yeah, sure. So the question is really around implementation. How easy or how is the transition process from actually implementing the solution? So from the government staff using it to the actual use of the solution.
Oh, right. So
really,
yeah,
what is that implementation process?
It's very rapid. So again, there's a number of approaches to this. We have, again, a lot of customers all over the world with our solution already. So we built a number of apps that are specifically COVID-19 related. And for those customers that have our, foundation software, let's say, we're able to, or in some cases, they're able to install it themselves, so we can do it very quickly. So it's a matter of days to get that going. Equally, if you're not an existing customer of this technology, then we can stand it up in the cloud like in a matter of days, one or 2 days. So it's very, very quick. And, it needs to be. And that's why we've responded so quickly to make this accessible in a very short time frame so it can start to get benefit really quickly as well. Again, sorry, we recognize... Yeah, sorry, go ahead, Iain.
No, I was just going to say that it's perhaps worth adding to that although we've been working on building these apps using those foundation capabilities, they are configurable. So it doesn't mean that what we give you is what you have to use. You can amend it and mold it to fit your particular requirements and your particular needs.
Indeed, and again, the other reason for that is, of course, the requirements are changing as well. That's another important piece. And yes, I was going to say that we recognise the fact that, I'm not going into specifics now, but commercially we recognise this is a very, hopefully, temporary period, and our at least for one of the solutions that I'm thinking about specifically here. Our commercials reflect that. So again, if there's something that's of interest here, do get in touch with us. We've got contacts at the end here, and we can elaborate further.
Thank you. That wraps up the Q&A at this time, but if anyone on the line still has a question, you can submit it through the Q&A and we can follow up with you via email after the presentation. I do want to remind everyone that Verint is hosting a series of educational webinars, so this is just one. Join us. Our next session is next week on April 16th. You can register for this event and others by accessing the resource list on your console. There are several webinars that are on demand as well. I also would like to let you know that Verint is going virtual. So mark your calendars for May 20th through 21st. This is a free and 2-day virtual event where you could network, learn, and plug into just a community of peers that are working on customer engagement. So registration will open shortly, but for now, just mark your calendars and save the date to join us. Last but not least, if you want more information or if you just would like to access some supporting resources that are similar to the topic we presented today, the resource tab in your console has lots of supporting materials. As always, we have an open door and you can reach us at info@verint.com if you have any additional questions. So David or Iain, over to you for closing remarks.
Thank you, Hayley. So I'm going to say thank you for a second time. Thank you this time for joining us today. We hope you found it useful and thought-provoking, but please, please, please do not hesitate to contact us if you think we can help you in any way, even if it's only just to chat through an issue that you've got and get a different perspective on it. We'd be only too pleased to do anything we can to lend weight to all of your efforts to help us deal with this horrible crisis that the world is facing. We're only too well aware of how tough it is for everybody at the moment, and want to do our bit. So thank you again. Stay well, stay safe. We will get through this. Thank you, everybody.